found is from an MSF study last year, not last year, 2008, in Cité du Soleil, which is the poor, lower-income neighborhood of Port-au-Prince. And what is remarkable over here is that there is about between, say, if you add violence, it's self-evident, it's in French, but you know, this is self-evident that it's between violence and sorcellerie and empoisonnement, poisonings, you have about 35% of the deaths. This is what? This is, Olivia and I were talking, it's like 5 times, maybe 6 times higher than most of the violence-related deaths in Darfur. Violence-related Darfur in the conflict areas range from 6, I don't know, I mean, if you have the specialists sitting over there, range from 5, 6, 7%. So maybe some injuries. We're talking of a third of the deaths over here in this particular area that are violence-related. So these are very, very important factors that to take into account, and they are very important factors to keep in mind when the emergency program is being rolled out, and to remember that this is not a 3-month emergency in Haiti. And humanitarian aid must not be deployed on a 3-month basis. This is not what we're talking about. This is a special case. Now, with that, I'm going to pass on to something else. We're going to, for the moment, just listen to me. I should put this crap up. What I would like to tell you is just take a few minutes to situate this interest in documentation and data gathering in the history of humanitarian aid. So where is this coming from? This is not an age-old tradition, remember. Many of you are young over here, you've sort of started your university studies with data and documentation being already at priority 1. But this is a 5-year phenomenon, 6-year phenomenon, maybe best 8-year phenomenon, nothing more than that. Earlier on, what was it? Remember that before 1990, before 1985, say, before 1985, mid-1980s, humanitarian aid was a hyper-marginal affair. The WHO, HAC, which is now, HAC sounds like a cough, HAC, which is now, what, I don't know, 30, 40, 50 people? More? 100? 70. Yeah, so that, this is today that. In 1985, when we had something to do with, it was not called HAC at that time, it was called ERO, WHO, ERO, Emergency Relief Office. An emergency relief office consisted of one man, Dr. Gunn. Dr. Gunn used to be the emergency person. None of you remember him. He's still around. He's still part of the disaster medicine world. It used to be Dr. Gunn. And Dr. Gunn was Mr. Emergency Relief. This was it. This was one man. He had some discretionary funds. I would even say he had discretionary funds which would amount to some ridiculous amount like $500,000. So he had $500,000, and Mr. Gunn Dr. Gunn would run around giving this $500,000 to people. This was emergency relief. 1985, something important happened. Really, really important happened. A turning point in the whole humanitarian scene. There were the famines in Africa, the second big Sahelian famines. And this really was the watershed. And 1985 was the famines in Africa, UN's General Assembly resolution, and suddenly humanitarian aid became important. And what happened then? Only one thing happened then, which is actually the genesis of what we are here for. The concept of early warning for disasters came into being. Early warning system, SAP, Système d'Alerte Précoce, which is Médecins Sans Frontières who started it, only related to famines in Africa. So suddenly, at that time, Dimbleby, BBC brought the famine of Africa into the television, and suddenly people woke up and said, this cannot happen again, this is the second time it's happened. 1973 it happened, 1985 it happened, it cannot happen again. And so the idea was, let us collect data to have an early warning. We must have an early warning of an upcoming disaster like this, where people are actually dying in lines for food. This is what we saw. And then there was the very successful, still used, FUSE, Famine Early Warning System, funded by the US government, and also the Système d'Alerte Précoce of Médecins Sans Frontières, which was set up, very successful, but for their own purposes. FUSE is a public service. This started this whole idea of indicators, early warning indicators. Can we watch children? Are children good indicators for an upcoming famine? So this whole concept of data collection, nutrition, all of that came into being then. And then, of course, there was the Cold War. And what happened after the Cold War is that humanitarian budgets increased steadily over the next, 10, 15 years. Up and down, up and down, up and down. It went straight up. As monies went up, of course, you have to spend the money somehow. And the best way to spend the money is to have NGOs. NGOs spend money fast. They usually increasingly spend money well, and they are attracted by money, rightly so, because otherwise nobody else is going on, the governments are not going on, and NGOs increase. So what happened? You had more money, you had more NGOs, and suddenly you had a situation somewhere early 2000, 2002, you had a situation where with the tsunami money and things, everyone started saying, but where's the evidence of performance? Where is the evidence of need? And we want data to make our decisions. So you started with the famine early warning system, where the famines in Africa started this data collection, early warning indicators, and then you had an increase in money, increase in NGOs, and then you had people, donors asking for accountability. So you need data to figure out, am I going to give you $2 million, $3 million? Show me the proof that there is a need. And that is what we are here to do. So that's the history of the data.